Thank you everyone that's joining us this afternoon for Menopause in the Workplace, everything you need to know but we're too afraid to ask. A much requested webinar topic, and as I say, we've got a lot of people that have registered on this, so it promises to be a really good hour ahead. My name's Nicole Core and I'm the Marketing Director here at Medigold Health, and I also head up our webinar programme. So I will hand over now to our lovely panel. Over to you, Nikki.
Thanks, Nicole. I'm Nicky Piper. I'm the Chief Nursing Officer here at Medigold Health. Been here for the last 5 years, so I come from that clinical aspect, but I'm also a woman going through the menopause, so I can do a little bit of life share with you on that front. I'll hand over to Barrie.
Thank you, Nikki. Hello, everyone. My name is Barrie Norman Jr., and I have the privilege of serving as the operational lead for the training and consultancy team here at Medigold Health. In this role, my team and I are dedicated to delivering a comprehensive suite of health and wellbeing training courses tailored to the needs of our clients, whether it's neurodiversity training, disability and health, through to guiding businesses to become disability confident level 3 status. With a background as a qualified mental health first aid instructor, I have the privilege of personally delivering over 200 mental health first aid courses since obtaining my certification in 2017. Furthermore, I also hold the unique role of being the sole suicide first aid instructor at Medigold Health. At this point, I typically share insights from my military background, which includes experience with PTSD, depression, generalized anxiety disorder, and my own suicide attempt. And these experiences do inform my approach to the training and advocacy I stand for. However, when it comes to the topic of menopause, I find myself on a similar learning journey as many of you. I'm here to listen, learn, and grow. I'm not here as an expert, as a fellow learner on this journey. Over to yourself, Lizzie.
Good afternoon, everyone. Thanks, Barrie. I am Lizzie Raye, and I'm a disability advisor and vocational rehabilitation consultant for Medigold's Workplace Adjustments team. So our role is to advise and guide on potential workplace adjustments across the range of disabilities and barriers that people face within work. So I am, as you can see, a woman, so I have this to look forward to in my future. But I'm a little bit with Barrie on this one because as a relatively young woman, I know very little about menopause until actually going into this today. So what are we going to look at today then? So we're going to start it off nice and simple. What is menopause? Okay, we're going to look at some facts and some myths, maybe some of the things that we think we know but perhaps aren't actually correct. We're going to look at symptoms and how they can impact you at work. We're going to look at the issues with disclosure, so how people actually feel about disclosing that they're menopausal within work. We're going to think about how to make conversations about the menopause easier and less of a big deal, if you like. We're also going to look at workplace adjustments, which may be helpful, and what a business could and should be doing about the menopause. So to start us off then, I am going to look at a little bit of myth busting, okay? So I've got 6 myths on here for you. We're going to go through them one by one. So the first one is that all women understand menopause well. So I have checked and I can confirm there is no secret club, no insider knowledge because you're female. All our information we get from life experience. So the knowledge that most women have about menopause comes from lived experience that can either be their own or that of those very close to them. Sex education and biology at school, it introduces us to the reproductive system, but the focus is actually on anatomy and how not to get pregnant. Yes, they touch on the impact of hormones and the impact that has on your body, when they increase, but there's little mention of the effects of hormones on your body and brain through the menstrual cycle, and no one ever mentions what happens when those hormones decrease. So dependent on your generation, it may be that your mother's rarely talked about such personal issues at all, let alone with their children. Add to this the challenge of describing these experiences when you've never really been given the language for it. It's still very much a taboo subject, and many women are still very reluctant to share their challenges with family and close friends, let alone their employer. So what do we have next then? The menopause starts when periods stop. So although the term menopause literally means the ceasing of menstruation, it's not a single event though, but more of a movement through a process, often described as the menopause transition. So we can break the process down into 3 phases for ease of understanding, but don't make the mistake of thinking that this is an easy process. So it starts off very much with perimenopause, which is the term that we use to describe the period before the menopause when women experience menopausal symptoms, but they're still menstruating. So often their periods are further apart or closer together, and they can be irregular and heavier or lighter in flow. So basically, everything is going a bit haywire, okay? During the perimenopause, the levels of estrogen and progesterone fluctuate greatly, and it's often an imbalance of these hormones, which leads to symptoms of the menopause occurring. After perimenopause, we go into full-blown menopause, okay? Just menopause as is. So that itself is classed as being 12 months after a woman has experienced her last period. The difficulty with that one is that sometimes we think we're in menopause, and then all of a sudden we're kind of faced with another menstrual cycle unexpectedly, and actually we're still in that perimenopause period. So after menopause, we go to postmenopause, which is the time after a woman has kind of completed that menopause process. So during this time, many of the symptoms gradually decrease, but as there is lowered levels of estrogen, among other factors, postmenopausal women are at an increased risk for a number of health conditions, such as osteoporosis and heart disease. So the next one then. Menopause only happens after 50. I wonder if this is one that you guys believe or have believed. When do you think menopause actually starts? Think about it. So it goes without saying that everyone's unique, but it usually occurs between 45 and 55 years of age. However, massive disclaimer there, it can occur anytime up to a woman's mid-60s. You can also have premature or early menopause, and this refers to periods stopping before the age of 40. So that can either happen naturally or as an effect of a medical condition or its treatment. Things like surgical treatments, such as a hysterectomy, can induce something called a surgical menopause, and often women aren't provided with any kind of preparatory information or support for this at all. And around 1 in 100 women will experience premature menopause, and this of course can be at a time when still planning to actually conceive, which can be devastating. So the next one, menopause doesn't adversely affect many women. For this one, I'm going to refer to some statistics as they very clearly show a different story. So around 1 in every 3 women has either experienced or is currently going through the menopause. According to Trade Union Congress, they delivered a report. Around 8 in every 10 women will experience noticeable symptoms, and of those, 45% will find their symptoms hard to deal with. that is almost half. The Menopause Survey in 2018 asked women across policing in England and Wales for their experiences of having gone through or going through the menopause. 76% of respondents said that they had found symptoms of the menopause either moderately or extremely problematic at work. 19% of respondents reported having time off work due to menopausal or perimenopausal symptoms. And 20% considered leaving because they were finding it so difficult to deal with their symptoms at work. That increases to 44% of those who found their symptoms extremely problematic. That's a large part of your workforce that is actually considering leaving work because their symptoms are so difficult to deal with within work. So, how about the idea that menopause symptoms don't last very long? Anyone have any guesses on how long the menopause lasts? So, the full menopausal transition process can last anywhere between 7 and 14 years. Menopausal symptoms typically persist for around 4 years, but that can be a lot more or a lot less. What can make this so much worse is not having a definitive time frame. So when we have the flu, for example, we have a good idea of how long symptoms will last, and we know when we're going to feel better. With menopausal symptoms, it is impossible to put an end date on it, which can have a profound effect on women's mental health, causing feelings of depression and hopelessness. So last one, but by no means least on our myth list, menopause is all about hot flushes. And this is the one that I have to admit to believing in the past, okay? Hot flushes is the symptom that most people associate with menopause. And it is one of the most common, but actually there are over 40 symptoms which women could experience as part of that menopause transition. The symptoms are associated with a decrease in the body's production of the hormone estrogen. Estrogen protects a number of different symptoms in your body, different systems, in your body. So your brain, your skin, your bones, your heart, urinary functions, and the genital area. Low levels of estrogen can affect all of these parts of your body, hence the huge range of symptoms. So I'm now going to pass you over to the fantastic Nicky, who is going to talk you through some of those symptoms in more depth.
Thanks, Lizzie. It's interesting just looking at the chat function as we're kind of talking here about some of the experiences, and you know, it kind of fills you with some level of kind of upset that people are trying to get some level of support and really are not able to get that level of support. There's a little slide later on where we talk about some of the things you can do, but what I would say is if your GP is not listening, you have a right to have support. So regardless of what they're saying, have a right, be assertive, take somebody with you if you're not feeling assertive, because we'll talk about the cognitive effects of the menopause, and insist that they listen to you and take heed of what you're saying. Do a little bit of research along the way so you've got some insight into what you want them to help you with. But I'll try and cover that a little bit more further down the line. But I just wanted to acknowledge that, as it was something that I'd seen pop through the chat, and where people have had you know, surgery, the hysterectomy, for example, and was given no advice. That's absolutely appalling in the medical world, because if they're doing something so radical as a hysterectomy, which will impact, particularly if they've taken your ovaries away, then you will enter into a menopausal state immediately, and the effects can happen very, very quickly. So, you know, that's really bad medical, that's very bad medical practice that you've experienced, and certainly shouldn't be happening. And I'd probably tempted to put in a PALS complaint in regards to that, because that is an element of kind of not negligence as in they haven't done anything, but certainly something that they shouldn't be doing when they can potentially induce that menopausal experience. So thanks, Lizzie. I'll go on to talk about some signs and symptoms with you all. And I think one of the key things you said, Lizzie, at the very beginning is we get taught about sex education when we're little, and then that's where it ends. And then all of a sudden you hit that kind of middle of life, which is the next phase of life, as I like to think of it as, and you've had no preparation, no warning. Things start happening to your body that you think, what the heck's going on? And I can speak of this from an experiential place. Somebody also put, they never had a hot flush. Neither have I, and I freeze to death even in the hottest of temperatures. So not everyone will get that hot flush experience. I've got friends that have had it, and it looks absolutely awful, where they just want to take their clothes off in the middle of anywhere just to get that cooling sensation and feel into their body. Or they wake up in that flood of sweat and have to change the bedclothes. That can be the kind of extremes of the experience. But I think that the difficulty is with the menopause, and I think one of the difficulties that I think sometimes inexperienced GPs, or perhaps old-fashioned GPs, as I would call them, don't take into consideration is everyone's experience is quite unique. For myself, I had very little in the way of physical symptoms. I did have a bit of skin itchiness, and it felt like all the time there was something crawling on my skin for a short period of time. But I didn't have any of the other spells of flushes, night sweats. Some people say their skin feels a bit like it's being electrocuted. So quite nasty tingling of the extremities, very uncomfortable, a burning mouth sensation. Dizziness is very common, but people don't always relate it to being the menopausal symptoms. And tinnitus, which is a ringing in the ears, is also a very distracting and distressing symptom. There's lots of stuff you can do for tinnitus by using white noise to work against that. But all of those in combination, or just single things that are happening to you, don't necessarily equate people's thoughts automatically to the menopause. From a personal perspective, my main issue was cognitive issues. So doing a presentation like this filled me with dread, because I couldn't string a sentence together, and I'd gone from being quite articulate, or so I believed anyway, to then having a real struggle to put 3 or 4 words together. And I knew what I wanted to say, but I just could not find the words to actually say it. And I obviously work with a really good team of people, and they're all of different age groups, and they used to start helping me finish my sentences, which was lovely, but equally it didn't help my confidence or make me feel particularly useful. So that for me was kind of my first symptoms after the itchy skin. I had a hysterectomy too, so I didn't have the period element, but I did keep my ovaries, so I was still getting the hormonal input, but it was definitely the cognitive issues, the funny skin feelings, and then I noticed I'd become very anxious, hyper alert, a little bit sensitive, which was very opposite to my normal personality. Again, as I would believe, but no, my friends also told me that I was a bit hypersensitive. I have some good friends, and I think all of these kind of things then start to knock onto your confidence, your ability to continue living your life as you've been living it. And I think a combination of all of those kind of mixtures start to make you think you're actually losing the plot, which again has that negative impact. So some of the emotional things are quite irritable. My husband would say that I was quite irritable. The mood swings, The anxiety bit was really irrational from my perspective. I'd go to the airport, and the minute the gate came up that I was going on holiday, I had to be at the gate straight away, and I'd be panicking to the point till I got to the gate, which is completely irrational because the gate stays open for quite some time. So that was kind of where I started to pick up these kind of anxiety issues. I just thought I was just being a bit grumpy in general format, but obviously putting all these kind of bits of the picture together then starts to show you the very seriousness of what the menopause is. Sexual interest also disappears, which also can have quite a negative impact on a relationship, particularly if the partner isn't necessarily understanding of what the symptoms are, which is why I always feel this is a really good kind of presentation for all genders, to be fair, and for all age groups, so that they can actually start to pick up and see. And it was only as I was going through the symptoms myself that I reflected back and thought about my mum's experience of the menopause and how she was throughout that period of time. So really, really kind of important. And there's lots of other things that don't necessarily link together, but are probably also interrelated with the menopausal symptoms. I think the dryness in multiple places is also a very difficult thing to cope with. There's lots of really good stuff on the market to utilize to help with that. And so certainly something that I would advocate you look into, because then it kind of keeps the pleasant experiences of life still capable and fun, if you like. The low self-esteem, stamina is often where, when you go to the doctor with your signs and symptoms, they'll often allude to you possibly being depressed. And that is kind of, we do lose those hormones, and it does have an impact on our mental well-being. And it could well be that you're depressed as well as menopausal. But I was offered antidepressants when I went to the doctors with my symptoms. I declined antidepressants and said I'd like to try HRT, thank you. And then if it still doesn't work, then we can talk again about whether it's a depressive illness or not. But I did have to be quite assertive with my doctor, and it was a female doctor as well, which I found quite disappointing, knowing that they're likely to enter this phase of their life at a later point. So lots of changes, psychological, physical. Pain and joint aches is another very common effect that people just put down to the aging process. The likelihood is it will be hormone related and is causing that to have that muscle tension, swelling, stiffness of joints. When you get out of bed in the morning and you think you feel like a 96-year-old rather than the 30, 40 or 50-year-old that you may well be at that period in time. Often a menopause start time is usually runs along the same line as your parent. So if your mum had her menopause at the age of 45, likelihood is you'll have yours on or around the same sort of time. So for those who are not at that phase, it's a reasonable time to look at an action. I think the perimenopause is still a treatable option. You don't have to wait till you hit the full menopause before you can kind of look at some treatments and things like that, because you can start to kind of get treatment as the signs and symptoms drastically increase and make life quite difficult. As I think you also alluded to earlier about some of the physical symptoms, your bone density starts to deplete. So it's really good, and I'll cover this a little bit later on, to work on some exercises to keep that bone density up as you transition through, and also into your older age category as well. Next one, please. I didn't read all of the symptoms because they do you know, the list is endless. And I think if you've got one or two or more, the likelihood is that you're either in that perimenopausal state, if you're still having periods and you've still got a uterus, or you're approaching that menopausal phase. So as I say, be assertive, go and talk to the doctor, don't be fobbed off. by excuses that they don't think you're there yet or you're not ready. You know, be quite assertive with that. So I was just going to talk about some of the physical and practical challenges of the impact on work. So for those who do experience the hot flushes, really good to wear a variety of level of clothing, because obviously 1 minute you'll have a normal body temperature, the next minute the temperature shoots high, and you just want to go somewhere cool, stand in the fridge in the supermarket aisles for a few minutes just to try and get that temperature down. In an office environment or in the workplace, this is often quite difficult to actually do unless you're in an air-conditioned office, which often is really helpful. So poor ventilation, poor air quality, high temperatures are going to have a very kind of have a very negative impact on those that are going through the menopausal symptoms. Limited access to water, particularly if you've got that dry mouth, you've got this increasing thirst, and you need access to cold water, because obviously cold water then cools down your body temperature as well. Again, toilet facilities, washing facilities, when people do have a hot sweat, they often like to try and go and wash down their face, cool themselves off, and without those kind of access of privacy facilities, then, you know, that's kind of a really difficult environment. Those face sprays are really good. Someone just popped on about the olive oil base one that contains some moisturizer, great. But there's also some spritz face sprays, which has just got kind of water in them, which also helps with the cooling effect. Long shifts, so working long hours, aching joints, tiredness, fatigue, all really difficult to do those long shifts, what under normal circumstances wouldn't have had the same impact on. So all of a sudden you've been working long shifts for years, then you start to go through the next phase of life, the menopause, and all of a sudden you can't cope with them and they become too much. Usually that's an impact of what's happening along the way for you. Again, this is why it's really important. The next phase about talking, inflexibility of breaks. If you're really struggling, good to kind of be able to kind of just say, can I just take 5 minutes out? I need to just give myself a minute or two just to reacclimatize, realign. Large workloads, as I said to you, my main issue was about cognition. I used to work at a really fast rate, and all of a sudden I found that I wasn't able to cope with my workload anymore. But I'd always been good and efficient, but all of a sudden I was feeling inadequate. And that was kind of quite soul destroying, if I'm honest, because I always prided myself that I was able to keep up, keep going, do the things I needed to do. And all of a sudden I found myself looking at myself as a failure, when in essence, I wasn't a failure. I was actually dealing with something beyond my control. So, you know, workload and workplace stress are another indication of why you might be struggling. There are other reasons why, if you've got an excess workload, you may be struggling too. But these are all kind of contributing factors that can impact on you whilst at work. Again, traveling, staying away from home, upsetting your normal routine, you know, because we all like a bit of routine, but upsetting that routine then becomes difficult to cope with sometimes. So again, these are all kind of things that are common. And also certain materials can cause that irritation and itching, or can be too hot. So uniform PPE that may have been okay may well start to become an issue. So really important to think about all of those things when you're in the workplace and what can be impacting, but also we'll then move on to what might be able to be done to assist. Thanks. So again, looking at interpersonal challenges, we have talked around some of these. So I think it's really important that we need to start to look at changing some of these negative interpersonal challenges. Negative attitudes are often ignorance, I would say, where they haven't got that knowledge, awareness, or awareness about them to then be able to challenge those negatives. But plus, as an individual, you're feeling already quite under your normal par. So challenging negative attitudes is quite difficult. But we certainly need to look at that as a more larger piece. Unsympathetic line manager. I've seen a couple of things coming through about line managers and line manager training. I would agree 100% that this kind of information sharing would be really useful for line managers and would be something that could start that conversation around what they can do to support you. And we will touch on that shortly. And again, it's about not having the knowledge. And I think health issues generally for women and for men, if I'm honest, because we're probably a little bit ignorant to some of the male challenges in life too. But I think education around anything that's relevant and impacting is always a really positive thing and can certainly help to change some of the behaviours that sadly we see, and particularly where, as Lizzie said earlier, where we lose really good people in the work environment because they're not being supported and given the appropriate amount of help and support in place. Thank you. Over to you, Lizzie.
Thank you, Nikki. So why I want us to consider, what might influence a woman's decision to disclose her menopause-related difficulties at work. So referring back to the policing menopause survey from 2018 that I referenced earlier, 44% of respondents who had taken sickness absence due to the menopause had not told their manager the real reason for their absence. So why are women feeling so reluctant to disclose that they're experiencing menopausal symptoms? Well, some women feel it's private and personal, and disclosing is always 100% a personal choice. However, the perception of this being a private issue may actually be perpetuating women's embarrassment in discussing the menopause and their experiences. Perhaps, as Nikki said, women don't feel that their line manager they understand enough, or perhaps they don't know you very well. That can make it really difficult to talk about something that's so sensitive. Where your line manager is male, that can also present another barrier. And I think one of the aims of today is very much bringing men into the conversation and encouraging us all to be menopause aware, so that women feel they can discuss this with male line managers or male colleagues. Maybe there's also a fear that their difficulties won't be taken seriously. After all, understanding and awareness around the menopause is often minimal, hence why we're here today. Women might also be concerned about confidentiality and that everyone will find out about it if they disclose it to a manager. And I think this ties back very much to embarrassment, although I would be very concerned about that manager if this were the case, because any health information is completely your information and should be kept confidential. The menopause is equally as important that it remains confidential unless you choose to disclose. So women also may be worried about being perceived as less capable than they were before, and that this might have a negative effect on their career progression and promotion. They may even worry that it will put their job at risk. Perhaps they're concerned about negative attitudes, maybe some inappropriate jokes that unintentionally offend, or outright discrimination from managers or colleagues. But if you consider the symptoms of anxiety, low mood, and diminished confidence that women could already be experiencing related to the menopause, it's unsurprising that these worries exist, even where there are even positive relationships at work. I'm now going to pass you over to the wonderful Barrie, who's going to explore the menopause at work in a little bit more depth for her.
Fantastic. Thank you, Nicky. And obviously, thank you to Lizzie as well. It's a real wealth of information, both from my colleagues, Nicky and Lizzie, but also from the 500 plus attendees we got, and people sharing that lived experience and sharing best practices and ideas is what the webinar is all about. But also please remember, obviously, the session is being recorded and will be available on our YouTube channel for those people who do want to recapture and re-look through the signs and symptoms, for example. So menopause at work. So talking about menopause at work can be challenging for both managers and colleagues. And this challenge often arises from a combination of factors, including a lack of understanding, potential societal stigmas, and the deeply personal nature of the topic itself. Many people feel uncomfortable or at least uncertain about how to approach a topic, fearing that they may say something inappropriate or invade someone else's privacy. And as a manager, we often find it difficult to strike the right balance between that empathy and professionalism, uncertain about how to offer support without being that intrusive. Colleagues may also struggle with how to provide understanding or accommodations without making incorrect assumptions. And this discomfort can sometimes lead to silence, which inadvertently can cause those going through menopause to feel even more isolated. So as with any aspect of employee wellbeing, it is essential for workplaces to promote open communication, education, to handle these discussions with sensitivity and respect. And as a line manager, it's crucial to equip yourself with knowledge about menopause. And I, for one, have learned tons and tons of information in the last 45 minutes, 50 minutes now about menopause. And that has developed my confidence to discuss this topic with women in my team, my wife, and female friends as well. And as a manager within the workplace, you are often the first point of contact for addressing health concerns, managing work adjustments, implementing policies, handling absences, and returning and supporting return to work process. Your role involves two key elements, which is recognizing when a conversation is needed, and then ensuring that that conversation is productive and supportive. So if you notice someone experiencing adverse symptoms, it's important not to make assumptions about menopause, but rather take the opportunity to check in and ask how they are. Pay attention to any changes in work performance. If there's noticeable decline, ask if there's any underlying reasons contributing to it. And obviously, if a health or well-being concern comes up during the performance review, prioritize and address that concern first, and then return to the performance discussion later on. After any sickness-related absence, it's good practice to hold a return to work meeting, and this provides a chance for the individual to disclose any ongoing health issues, including menopause. And lastly, employee wellbeing should be a regular topic of every one-to-one meeting. And whilst, as Lizzie said, we can't force anyone to discuss or talk about their health concerns, including menopause, your role as a manager is to create opportunities for these discussions to fulfill. And by showing that genuine interest and concern for employees' health and well-being, you increase the likelihood that they feel more comfortable and open up and allowing you to provide the necessary support. So a few key principles to keep in mind during the conversations about menopause. Next slide, please. Thank you. Use open-ended questions to encourage the individual to share more and ensure they feel heard. And be patient, giving them time to think, and resist the urge to fill any silences too quickly. Listen to understand rather than listening to respond. Even if you have your own experience with menopause, avoid bringing it to the conversation unless they ask. If the individual becomes upset, emotional, remain calm and offer that reassurance, and pay attention to your body language. Maintain good eye contact and adopt a relaxed, open posture to convey a genuine interest. And approach the person and approach the conversation with empathy and understanding rather than pity, as this can come across a bit patronizing and sometimes has an element of superiority. As with any wellbeing discussion, it's helpful to ask the person what support they need and use that as a basis for planning the next steps. So we've already discussed how certain aspects of work can worsen menopause symptoms. So let's explore what can be done to address these issues. Next slide, please. Before we dive in, we need to keep 3 points in mind. We have a legal obligation. Failing to make any reasonable adjustment could result in claims under the Equality Act of 2010. Although in menopause isn't a specific protected characteristic under the Act, treating an employee less favourably due to menopause symptoms could be considered discrimination, especially if it relates to the protected characteristic like age, gender, disability, or sex. Boosting productivity. Workplace adjustments are designed to help employees perform at their best, which in turn adds value to the business, and getting these adjustments right can significantly enhance productivity. And then retention risks. Not making these necessary adjustments can lead to the absence or eventual departure of the talented, capable, and experienced women within our businesses. I'm now going to hand over back to Lizzie, who will now highlight some key workplace adjustments which could be beneficial.
Thank you very much, Barrie. So often workplace adjustments are free or relatively low cost to the organisation, but they can make an enormous difference. And as Barrie said, they can actually ensure that you keep and retain your talent. So looking at some of those physical sensations, such as hot flushes, electric shocks, tingling, skin issues, dizzy spells, some of the potential adjustments that we could include providing fans or making sure that someone's got access to fresh air whenever they need it, allowing them to open a window. I know it sounds ridiculous and really, really simple, but just ensuring that they're in an environment where they can open a window can make a really big difference. As Nicky said, having access to cold drinks or that dry mouth, ensuring that seating is available. So where someone's role is perhaps standing up, working in a factory, that sort of thing, ensuring that there is seating available to them so that they can rest. Permitting an exemption from or adjustments to uniform, to PPE, or to dress code. Where women are experiencing emotional or psychological symptoms such as mood swings, anxiety, low mood, depression, low confidence and self-esteem, it may be beneficial if their team are made aware, but disclaimer, this should only ever be done with a woman's consent, and it is 100% up to that individual to decide if they want their colleagues to know. So please don't go around just telling everyone. Another option could be to provide a workplace buddy who perhaps could provide well-being check-ins, where there's an opportunity for this person to discuss any difficulties or concerns that they're facing. Just having that solid one person who you can go to can make a really big difference to people's mental well-being. Managers should also try to manage targets and deadlines sympathetically, and wherever appropriate, signpost to services such as any internal employee assistance programs where they're available, or if they're not available, there's always the access to a mental health support service, which is available to everyone in work. So the cognitive impact of menopause is often really hard to manage within work. Memory lapses, poor focus and concentration, and the dreaded brain fog. It can be very useful to follow up verbal information with the same information in writing or vice versa. To offer support with planning, organising and prioritising. So being very clear, giving clear guidance on what you think needs to be prioritised, that can make a massive difference. And if possible, offer a quiet space to support with concentration, perhaps allowing increased working from home. And where we can't alter the environment, so where we can't make the environment quiet, consider providing some noise cancelling headphones or loop earplugs. There's also Flare and other brands of earplugs that can be really good. So where women are experiencing increased pain and fatigue symptoms, it might be a good idea to consider minimising travel requirements and permitting them to work from home wherever feasible, moving their workstation so they're close to the exit and staff facilities such as toilets and break areas, offering more frequent or longer breaks and ensuring that they're able to move around if needed. And even a quiet room for rest can help, although I recognise that space is a really hot commodity these days in many offices. So some of the physical and hormonal effects, which often cause the highest amounts of embarrassment, such as irregular periods, digestive problems, bloating, bladder issues. To support women experiencing this, it is worth thinking about access to toilet facilities. So is it possible to make access easier by moving their workstation closer? Is it also possible to offer washing facilities and sanitary products? And working from home and minimising travel can be hugely beneficial in this case. So wherever that's kind of operationally viable, it's really worth looking at. And where women are experiencing more severe medical effects, such as breathing difficulties, heart issues, osteoporosis, we should be encouraging them to seek and follow medical advice, and a referral to occupational health would be advised in that case, which is a perfect segue to pass you back over to Nicky, who is going to talk to us all things treatment and OCHA.
Thank you. I've seen lots of chat as well around the treatment options, about different types of things. So I thought I'd just kind of look at a few things as to how the organisation can certainly help with support, just following on from Lizzie. And then my next slide kind of just touches a little bit more on HRT versus the more natural products that you've all been chatting about in the chat box below. So I think there's a tiered approach really that needs to take place within the workplace. I think the acknowledgement of the impact of the menopause needs to also start at the top of the organization. So I think, you know, what we would advocate is that as an organization, you look at having a menopause policy, you look at having a support process in place to help steer and guide your managers. Education is another form that I think you've all agreed along the way is a really useful tool for organisations to have. And as you're part of this production, you can then take away this and use it in your training side of your own businesses to start to kind of break down those barriers within the kind of understanding of the menopause. You could be the advocate. In some organisations, they've set up a little bit of a menopause support group, and we've put on here around what colleagues can do to help support each other, run these awareness campaigns, have blogs, a bit like you've done today. The chat function today has been amazing, with some really helpful, useful tips for everybody, as well as we've been able to chip in and offer some elements along the way that you can't always address in the presentation part of it. So thanks all for your contributions in there. It has been amazing. And that's the kind of thing you could set up locally within your work environment to kind of help and share some of these experiences, because the lived experience is always the real one. And you also have the opportunity to be able to kind of forge and help organizations progress and develop that support structure. So the organization needs to take its ownership and responsibility from a leadership angle. We need to make sure that our managers have got a much better awareness, understanding, and how to signpost and get the right appropriate adjustments and support for people. And then there's what you can do as an individual is to help champion for awareness campaigns, look at information, blogs, set up your own chat groups so that you can share your lived experiences along the way. Thank you. Then I thought I'd just look very quickly at the conventional treatments. None of these are okay for everybody. So it is around finding out what works for you, what's good for you. So the conventional treatment has dramatically changed over the years. HRT used to be a scary thing, and cancer used to be often the kind of overhanging factor with HRT. Well, they've kind of purified it a hell of a lot over the years. And there was a really good TV program which involved Davina McCall, where she talked about all things menopause, and well worth a watch. You can probably pick it up on iPlayer or one of those kind of catch-up type programs. But basically the risks now have dramatically changed. They very rarely give tablet-based hormones. Hormones are very much now more patch related, gels, rubs. They have a whole host of different things that you can utilize. If you've got a history in the family of cancer, they'll be reluctant to offer you HRT because of the potential risks. But again, that's kind of changed quite dramatically. So always worth having a conversation with your GP about it, because things like the gels and the patches are less impacting from a cancer perspective. So you may not be precluded from using it if that's the route you want to go. But very good. I opted for the patch, and I must say within about 4 to 6 weeks, a lot of the symptoms I described to you earlier actually disappeared completely, and I felt I was almost back in my own skin again. So for me, that's worked really, really well. But I have friends who it hasn't worked for. So it's a bit like anything, isn't it? One treatment is not for everybody. Next slide, please. And then I put down a few herbal supplements. There are loads, and I've seen you all talking about loads within the text earlier. Black cohosh is known for its properties to help with hot flushes. Phytoestrogens are another natural substance that again help bring that body balance back. So you can get those from your soya milk, soya beans type food stuffs. St. John's wort again is known for its anxiety properties. Angelica ginseng, and you've been talking about all different other powders and potions. Again, there's no research behind the herbal supplements, which kind of leaves them a little bit kind of hanging in the balance for proof. And for some people they work, and for others they really don't. What I would say is always speak to a pharmacist, a GP, or even some of the really good people in places like Holland and Barrett, where they have a really good working knowledge about the hormones and what they help with or don't help with. One of the questions I saw was around how long should you give them before you kind of throw in the towel and decide that they're not working for you. You probably need to give yourself a good 4, maybe 6 weeks of taking them regularly. And when I say regularly, I mean daily, not forgetting a couple of days down the line, to see if they're going to be of benefit to you, because they do take a while to build up in your system. Similar kind of time frame for HRT. You know, you probably need to give it a good 4 weeks to see if that dose is right for you, or whether sometimes you need to have a higher dose. I started off on a very low dose. I noticed my symptoms returning. They increased the dose and they disappeared again. So again, it is about sometimes, a bit like with most illnesses, it sometimes takes a little bit of time to get that balance right and to find the right one that suits and matches your need. Unfortunately, there isn't a magic pill out there, but there's definitely a lot of opportunities to get to that right level. There are a few things you can do for yourself again, you know, similar things to what you'd expect to do in normal life, and that's eat a good, healthy, balanced diet. Some people find during the menopause, if they eat spicy food, it triggers those hot flushes. So if that's kind of one of your triggering factors, try and avoid those, obviously. Layers of clothing, as I mentioned earlier, gives you that opportunity to take layers off. We was laughing as we started, actually, the first picture of the lady with the polo neck jumper, I said was probably not the best image that we could have chosen, because a polo neck jumper is probably the last thing someone who has hot flushers would ever think about picking out of their wardrobe. So kind of be mindful about that, and the layers help you take off or put on when the temperature returns to some level of normal. Exercise to strengthen bones again will help reduce some of the medical issues that you may get. And although it used to be running and impact sports, now they're saying that kind of gentle weights, exercise type things are far better than running. So things do change along the way, but that's the kind of latest on the exercise front. Try and keep your stress to a minimum. I know that's not easy in the current society, but try and do your best and give yourself some you time. Try stopping smoking if you're a smoker, because that can add to some of the symptoms. And you know, just try and kind of keep that balance. Try and reduce weight if you're carrying extra weight, which is harder during the menopause. But again, all these things will start to help you balance some of those symptoms that you're experiencing. Thank you. And I think that takes us to questions, which we've got a few, haven't we, Nick?
It does actually, but it also takes us to the end of the webinar, I'm afraid. We've come up right to the end. So what we're going to do, because we have got questions, I just want to say, first of all, huge thanks to the panelists. That was brilliant. Also, huge thanks to the audience. I've never seen such an engaged chat. It just shows, you know, that connecting with people, discussing things that you're going through, and just the lack of awareness that's out there, you know. So that's why we put things like this on and do what we do to try and raise that awareness and support people. So it's given me goosebumps. I love it when the chat's going off like this. So a huge thank you. Because we've come to the end before we've had a chance for any questions, we will be following up with this webinar, because there's been so much talk and support and some great tips actually. So what we'll do tomorrow, you'll get a link, an email with a link to the recording, and then in the next week or so we'll produce a piece of content that's got some FAQs and some of the pieces that were on there on the slides, some of the kind of, you know, treatments and workplace adjustments as well. So we'll be sending that out to everyone that's registered, even if they didn't attend as well. So lots of lovely people saying thank you, but thank you all for coming, and yeah, thanks again panelists. Absolutely fantastic that session was. So bravo. Okay, have a lovely rest of your day, everyone.